Thank you, Madam Chair, and I thank the panel for being here today. I do want to focus on Exhibit G, on who bears the responsibility for the tissue procurement chart. As a nurse, I am well aware of how important it is to follow procedures, especially in performing your duties when you're caring for a patient that has trusted you as a care provider for their medical treatment. So let's walk through a day in the life of a procurement tech. And if you will please turn to Exhibit C for this question. In Exhibit C4, you will see that the tech gets an email gets an email like the one that's on C4, and she reads the order for certain baby body parts, including the gestation period, and knows what she needs to harvest for that day. And I want to reference second from the bottom line. It says that she will need a brain 16 to 18 weeks, and complete but can be in pieces. So she has a very specific tissue that she is looking for. Now, if we can turn to C9, Exhibit C9. And then she informs the abortion clinic staff of what she will be procuring on that day. And we actually see there on the first line where she communicates with the assistant manager. It says, upon arrival, inform the staff clearly of what you are procuring for the day. So let's follow on then with Exhibit C5. The procurement tech then reviews the medical files, which is another subject of whether this is a HIPAA violation, whether she has the rights to be looking at those files of the patients to learn their names and the gestation time of their baby. And she records this in a gestation tracking log, essentially matching the patient with her needs, not the patient's needs, but with her needs of what she's been given as her job for the day. Let's next turn to Exhibit number 8. Next, the procurement tech approaches the patient waiting for this abortion, and many times this is a young woman who is afraid, not always certain about what she's doing, and needs advice and counseling. But that's not what we see her getting here. This tech doesn't have much time, and she must match her orders with the patient who are at the right gestation time. So she asks for the patient by name, and then she consents with them to donate by saying that her baby tissue is about curing for potential diseases such as diabetes, Parkinson's, and heart disease. And I want to also reference the second paragraph here, where she actually says that the law in the state of California, which is where this is being done, requires that the tissue from your procedure be incinerated. If you go and look at the law there, she's leaving one thing out. She could offer to this mother to actually bury this baby. But that's left out. She has given, I think, decisions that are very difficult. Either you're going to incinerate this baby or you're going to give this baby up for research. I think that you certainly should be counseling and giving all options to this young woman who is in a very difficult situation in making that decision. Now let's turn to Exhibits C12. And then after that, C13, because after the abortion, the procurement tech collects the tissues and procures the baby body parts needed. She carries all of her supplies with her. And you'll see here in this particular exhibit that she has a very detailed instructions about what she is putting these body parts into. So this is not coming from the abortion clinic. This is actually coming from the procurement agency that she is working for. And then the tissue tech then arranges for the delivery. We can see that that is by FedEx. It's clear on the first exhibit and also on this one about who is paying for the delivery of this, not only the test tubes and so on that she will be using to put the specimen in. So let's go back again to Exhibit G, where we see here in Exhibit G a blank on where the expenses are for the abortion clinic, because as I walked you through her day, there's nothing to indicate that the abortion clinic has incurred any expenses. So let me ask you, Mr. Lemon, if you were to walk through this, how does this comprehensiveness of the tissue tech's work inform your thinking about whether the abortion clinic is profiting from the sale of baby body parts?
Thank you. I did consider that in my analysis here. And so the question that was raised earlier in the parliamentary question by the representative from New York was that maybe there was a conversation. And in this case, there was a conversation. But then the payment should be maybe for that conversation in the processing, because that's the only thing I see that where the abortion clinic would have any cost incurred for that conversation, not a per tissue, price per tissue payment. That informs me that we're talking about the sale of a part and not some reasonable cost. The other, I think, attack that a defense counsel, which I now do, would say is, well, they're also involved in the processing because the client, the patient is there. But the abortion itself is not the processing of the tissue. It's the creation of the tissue through the destruction of a human life. So I think there's really no argument I saw from any of this that the abortion clinic had any other cost. They were getting a per tissue payment.
Thank you, Mr. Lemon. I yield back.